You walk out to the mailbox and your legs feel fine, right? By the time you reach the end of the block, they start to feel heavy, burning or numb, almost as though they're filled up with concrete. You then sit down for a few minutes, symptoms improve, and then you can stand up and do it all over again. If that sounds familiar, you may have been told that you have lumbar spinal stenosis and that exercises can help. And although that's true, but how you exercise can influence whether you gradually walk farther or become more limited over time. I see 5 common and completely understandable mistakes. Number 5 may matter most because it helps you determine whether you are actually making progress or gradually losing function. At the end of this video, I will also explain which symptoms require urgent evaluation and which ones should send you directly to an emergency department. I'm Dr. Omar Ramos. I'm a fellowship trained spine surgeon. I see hundreds of patients with lumbar stenosis, a few of which benefit from surgery, but many of them can get to a place where their symptoms are manageable and their quality of life is reasonable when they approach this condition with the right goals and the right plan. This video is for general education. I cannot diagnose your symptoms or replace an examination by your own clinician. So let's start with mistake number 1, doing only stretches. Stretching is not the enemy. Gentle forward bending can temporarily settle stenosis-related leg symptoms in many people. But here is the problem. Temporary relief can feel sometimes like treatment. If your entire program consists of pulling your knees towards your chest or bending forward whenever your legs hurt, you may feel better for a few minutes without building the strength or endurance you need to walk farther over time. A more complete program generally needs 3 components: relief, strength, and conditioning. Relief means a movement or position that helps settle your symptoms. Strength might include something like a supported sit to stand to maintain strength in your hips and thighs. Conditioning might involve cycling, pull exercise, or appropriately structured walking intervals. These are categories, not a prescription for you. The specific exercises must be adapted to your symptoms, your balance, strength, and your medical history. The important point is that a movement that reduces discomfort is not necessarily a complete rehabilitation program. I also want to clarify what these exercises are and are not changing. They are not permanently reopening a narrowed spinal canal. They are intended to help you manage symptoms, preserve your strength, maintain conditioning, and function better with the stenosis you already have. So instead of doing only stretches, consider a program that includes 1 symptom relieving movement, 1 strengthening exercise, and 1 form of conditioning you can safely tolerate. So let's move on to mistake number 2, walking until the symptoms become unbearable. Here is something I hear from patients almost every week. I walk until my legs are on fire, then I sit down and I'm finished for the day. That creates a boom and bust cycle. On good day, you push yourself as far as possible, your symptoms then flare up significantly, then you avoid walking for the next day or 2, or sometimes couple weeks. When you feel better, you repeat the same process all over again. You can work extremely hard within that cycle and still become less active over time because the activity was never broken into an amount you could tolerate consistently. The goal is not to prove how much discomfort you can withstand. The goal is to gradually increase what your body can do. Start by determining your current walking threshold. Use a watch or a phone and record approximately how long you can walk before your leg symptoms clearly begin, and not when they become unbearable, but when they first appear and start building up. That may be 30 seconds, 3 minutes, or 15 minutes. Everyone's starting point will be different. Then I want you to try walking for slightly less than that amount of time. Sit down or use a comfortable recovery position and allow the symptoms to settle. Then repeat that interval. Everyone's numbers will be different. The screen shows one example of how an interval program might be structured. Let's say you can walk 3 minutes, symptoms then come on, you stop, recover 1 to 2 minutes, then you repeat that cycle 3 to 5 times. Again, this is an example. I want you to build your own from your own threshold. As your tolerance improves, then you can change 1 variable at a time, right? So you may lengthen the walking interval, add another interval, or increase the total exercise time. Do not increase everything simultaneously. And perform these intervals somewhere where you can sit down safely, a track, a mall loop, or a short route close to home. Do not walk far out on the trail if the only way back is to continue walking on the legs that are already becoming weak or unreliable. If your balance is impaired or your legs are giving way, discuss the safest exercise environment and whether you need an assistive device with your clinician or physical therapist. Now, let's go to mistake number 3, which is stopping activity completely. So, the opposite mistake to number 2 is stopping nearly all activities because standing and walking provoke the symptoms. That reaction is understandable. If something hurts, avoiding it can feel like the safest decision because you don't want to hurt anything or cause more issues. But prolonging activity also has consequences. Your legs become weaker, your cardiovascular condition declines, your balance may deteriorate. Ordinary activities such as climbing stairs, getting out of a chair, or walking through a grocery store then require a larger percentage of the strength and endurance you have left. The stenosis may not have changed, but your physical reserve has. So then, this creates a difficult cycle. Stenosis limits your walking, then less walking leads to weakness and deconditioning, and that weakness and deconditioning may walking even harder. So instead of eliminating activity, look for a form of movement your body tolerates. For many people with lumbar stenosis, that may be a recumbent bicycle, pool exercise, short walking intervals, seated conditioning, or a supervised physical therapy program. Cycling is often better tolerated because the slightly flexed position may reduce the leg symptoms, but cycling is not mandatory and it will not be appropriate for everyone. The best exercise is not necessarily the most impressive one, it is the one that you can perform safely, recover from, and then repeat consistently. Consistency is key. If 5 minutes is your current ability, then start there. A small amount that you can repeat consistently is more useful than one heroic session followed by several days or weeks of inactivity. Now, mistake number 4, forcing a generic back exercise program. Let me ask you something. Can you push a shopping cart around a store for 20 or 30 minutes but struggle to walk from the parking lot to the entrance without stopping? That is called the shopping cart sign. It is a clue that posture may be influencing your symptoms. The medical term is neurogenic claudication. That sensation of leg pain, heaviness, numbness, or weakness brought on by standing or walking and commonly improved by sitting or leaning forward. Leaning forward can provide slightly more room for the nerve in the lumbar spine. Standing upright or extending backwards may reduce that space and provoke symptoms in some people. The mistake is assuming that every person with back or leg pain should follow the same exercise program. Some people are told that they must always stand perfectly upright or repeatedly arch backwards because that represents good postures and strengthens the muscle in your back. Others are told that anyone with stenosis must avoid extension completely, and both statements are just too simplistic. The useful question is not whether an exercise appears on someone's universal good list or bad list. The question is, what repeatedly happens to your symptoms and function when you perform that activity? If a movement consistently increases the leg pain, the numbness, heaviness, or weakness, and those symptoms persist afterwards, do not keep forcing it, simply because someone called it a good back exercise. Reduce the range, decrease the repetitions, modify the position, or work with a physical therapist to find an alternative that works better for you. At the same time, do not become afraid of every temporary sensation. A brief, mild increase in symptoms does not automatically mean that you have injured your spine or caused any damage. But persistent symptoms, progressive weakness, or worsening neurologic function should definitely be evaluated properly. A good program should account for your individual symptoms pattern without treating every movement as either universally safe or universally dangerous. Let's discuss now mistake number 5, measuring the wrong things. This is the one I said might matter most. The reason is that many people judge whether they are improving using only 2 things, their pain level and the word severe on their MRI report. And although both are important, both are incomplete when used alone. Pain can fluctuate with sleep, stress, activity, medication, and what you did the previous day. And an MRI cannot tell me exactly how far you can walk or how much the stenosis affects your daily life. I have seen concerning looking scans in people who remain very active and modest looking scans in people who cannot complete a trip through the grocery store. Imaging has to be interpreted alongside your symptoms, your physical examination, and your function level. Instead of tracking only the pain, consider tracking 4 functional measurements. First, your threshold. This is how long you can stand or walk before the symptoms begin. Second is the total. how much walking or conditioning can you complete altogether? And third is the recovery. How long does it take for the symptoms to settle after you stop? And then fourth is your strength and balance. Can you still get out of a chair without using your hands? Can you manage the stairs? Are you stumbling more frequently? Record all of these measurements under similar conditions approximately once a week. Although you could do this every day, daily measurements can fluctuate a lot. So a consistent weekly measurement makes the overall trend a lot easier to recognize. And if you're walking longer, recovering faster, and maintaining your strength, even if some discomfort remains, that may represent meaningful progress. But the trend works in both directions, right? So if your walking distance is steadily shrinking, your balance is deteriorating, or your weakness is progressing, that is not a signal to simply add more exercise. It is a reason to be examined. Remember that not every case of leg pain with walking comes from the lumbar stenosis. Hip arthritis, peripheral neuropathy, and circulation problems can all overlap with these symptoms, but the evaluation and treatment may be different. I cover how doctors begin separating those conditions in a separate video. I'll put a link in the description. Now that we have gone through the 5 mistakes, let's go through a practical plan. Here is the complete framework. Choose one movement that helps settle your symptoms. Include one functional strengthening exercise, then choose one conditioning activity you can tolerate. Build walking intervals around your current threshold rather than walking until your symptoms become unbearable. And record your function once a week so you can follow the trend. Make gradual adjustments based on several weeks of progress, not one unusually good day or an unusually bad day. And remember that lumbar stenosis does not mean you should stop moving. It also does not mean forcing yourself through every painful activity. It means moving with a plan and a purpose. Calm the symptoms, maintain your strength, protect your conditioning, and gradually improve the activities that matter to you. Grocery store, the stairs, the driveway, or walk around the neighborhood. If you want to see examples of the relief, mobility, strength, and conditioning categories, I demonstrate 4 movements in my previous lumbar stenosis video. I'll link that video in the description as well. Which of these 5 mistakes has been the hardest for you to avoid? Let me know in the comments. I read them, and they help me decide which questions to address in future videos. If you found this video helpful, please subscribe to support the channel. But before you go, there is one important safety point. Exercise is not the correct response to every change in your symptoms. Go to an emergency department immediately if you develop new difficulty controlling or emptying your bladder, new loss of bowel control, or new numbness around the genitals, inner thighs, buttocks, or saddle region. Those can be warning signs of Claudication syndrome and require emergency evaluation. Also, rapidly worsening leg weakness or new or worsening foot drop also requires urgent medical assessment. Foot drop may cause your toes to catch on the carpet, make you trip while climbing stairs, or cause your foot to slap the ground when you walk. This is not a complete list. Any rapidly changing neurologic symptom deserves prompt medical attention, not a wait-and-see approach, and not another YouTube exercise. I'm Omar Ramos, fellowship trained spine surgeon. I'll see you on the next one.